My name is Dr. Watcoun-Nchinda Pisoh. I'm a gastroenterologist in hepatology, joining West Georgia Gastroenterology Associates. My father had a huge influence in me deciding to go into gastroenterology. As a general surgeon, he was basically the gastroenterologist in the community because we had no gastroenterologist. And my father had this thing where he came back home and always talked about his cases and the most interesting things he did that day. And most of them circled around the gastrointestinal system. And on my part, I had a fascination with the whole function, the whole machine of the gastrointestinal system. It was an intrigue to me that people could eat so many different things, and the body, through the gastrointestinal system, was able to filter what the body needed and got rid of the things that the body did not need. And as a child, I tried to understand that machine. I think to me the most important thing, or the most significant thing I enjoy with practice, is relationships. The relationships that I create by when I see patients. Patients are human beings first. They're not just diagnoses. They're basically people that have problems. I speak both English and French fluently. Et j'invite tous les amis et les ressortissants francophones de venir me voir si vous avez des difficultés avec la langue anglaise. I said I invite any of our friends in the community who have trouble understanding English to come see me. I'm always very happy when the patients come back for a follow-up and they're doing a lot better than I saw them in the previous visits. It's so amazing that we can use technology, we can harness technology to help patients get better. I perform a variety of endoscopic procedures, colonoscopies for screening purposes and for diagnosis. With that also, I perform a lot of interventional procedures with colonoscopies, including stenting, including polyp resections, advanced polyp resections. I do those. I also perform endoscopic procedures where you go through the mouth with a camera. There are new procedures that keep coming about every year. One of them I'm really excited about is one that is directed at gastroesophageal reflux disease that affects about 20% of the US population. In patients that are not able to respond to medical therapy, there is endoscopic solutions through transoral incisionless fundoplication. So I'm able to collaborate with surgeons to provide lasting solutions to patients who have gastroesophageal reflux disease. When a patient comes to me, the first thing I want them to know is that they have a listening ear, that they've come to somebody who's going to listen to their problems. I want them to also know that they're getting a commitment from me to solve their problem, and that they're the focus of that interaction. I understand that they didn't just come to me because they were bored at home. They're coming to me because they have a problem and they're looking for solutions.